Hello, I'm Chris. I'll be your host for today. And if you're watching this, it's that we're looking to find an alternative solution for your knee pain using a non drug, non surgical approach to get you out of pain, decrease inflammation, and living life on your terms. Now, I always start with this question: what has your pain cost you? Now we could probably put a monetary value at that. How much, did you spend in vitamins or supplements or chiropractors or therapy? And I'm sure that the list goes on and on. How much time you have spent? But what we feel is the greatest cost is the opportunity cost. What can you no longer do due to your pain and condition? The pain in your knees or lower back, what has that taken away from you? If you could get one thing back in your life, what would that be? Is it dancing again with your spouse? Is it just walking? Is it actually being able to enjoy your garden, playing with your grandkids, exercising again, walking, going up, going downstairs, sleeping? There's so many things that at one point someone would take for granted, and they're becoming a chore to you because of osteoarthritis, degeneration in the lower spine or the knees. And we're going to show you how we've been able to help thousands of people get those very things back that you would love to do again, and even more because they got well and they're living life on their terms. So first we have to go over, what is your joint pain caused from? It's very important to know. So you can see my mouse here on the left, that is a normal knee, all right? So you can see the knee is lined up, the knee's lined up on each side. And what looks like a handlebar mustache in the middle there, here, it's very important that you learn this. It's called hyaline cartilage. We're going to spend a lot of time on the hyaline cartilage. This is the key. Now that hyaline cartilage, that is the cartilage in between the knee that secretes synovial fluid and stimulates the cells of that hyaline cartilage to continue to secrete synovial fluid. Now, when you look to the right, what do you see there? You see the hyaline cartilage is damaged. It's degenerated. That's an osteoarthritic knee. On the right, you can see it's bone on bone. Also, you can see there's shifting to the knee, so it's shearing like a pepper grinder. That's a degenerated knee. So the reason why you're having pain and the knee is being destroyed, the ligaments are lax, it's for one reason only: loss of tissue. And that is that hyaline cartilage. So that's what we're going to focus on, is restoring and getting as much tissue or space back in that knee to get you well again without drugs and without dangerous surgery. So I want you to think of the hyaline cartilage like a sponge. So on the left there, that is a healthy hyaline cartilage. See that healthy sponge? Look at the size of that sponge. Look at all the fluid that sponge could hold. So just think about it, all the fluid that sponge could hold right there. Now, we have to understand something. It's not due to age. Now, due to injury, due to wear and tear, due to weight issues, due to poor biomechanics, due to some underlying condition, that healthy sponge or that healthy hyaline cartilage starts to degenerate, starts to dwindle down, starts to wear away from abnormal wear and tear in space. It's damage over time. And then it becomes like the one on the right. So look at that sponge. It's all dried out, and it's probably, what would you say, 25 to 50% of the healthy one. So this is the downward cascade effect that has happened in your life. When you had this healthy sponge and when you were younger, every time you took a step, it would secrete fluid, and it would secrete fluids, water, and synovial fluid, and stimulate the production of more. But now, when there's degeneration or OA, now the sponge, let's say, is 25%, it holds less fluid. So every step you take, it secretes less fluid, less synovial fluid, and it does not then create the stimulation for more synovial fluid to occur. And it's a downward cascading event. So you have less and less fluid over time. It wears down more and more and more. Then it becomes very close to bone on bone. So when you start to get, like on the right, the osteoarthritis, we have some patients that say, or maybe yourself, after 10, even 20 minutes of walking, because it squeezes out that quote unquote sponge, you can't walk anymore. The pain's too bad because you're out of that synovial fluid. So the key is, how do we restore that dried up sponge to a more healthy, solid sponge secreting more of the synovial fluid? So that's this downward cascading event. So to go back to this x-ray again, now when you see on the left, you can see the hyaline cartilage in the middle right there. Now when we go to the unhealthy osteoarthritic knee, you saw the hyaline cartilage now was lost. There's bone on bone. It's not secreting the synovial fluid that it should. The lubricant's away. On the left, the healthy one, it's doing great. Now, why would the knee shear? Well, when you have that healthy sponge or that healthy cartilage, the ligaments and tendons around the knee are very taut. They're tight, like a tight rubber band, like a drum. When you lose the hyaline cartilage, what happens? The space decreases, and so the ligaments around the knee now, they start to get loose and create laxicity. So you see the downward spiral. You lose the hyaline cartilage. It's producing less synovial fluid. It's not stimulating more synovial fluid. The ligaments are getting lax. Now the bones start to shear and it creates that pepper grinding effect. And now degeneration happens rapidly. And what are you faced with at this point? Pain, suffering, not able to do the daily things in your life. And then you're faced with just a couple things. In healthcare today, they'll say this: you go to the doctors, and what are they going to give you? Option one, we're going to give you some drugs. The problem with drugs are, do they fix the root of the problem? No, they mask the symptoms. So when those symptoms being masked, is the problem getting better or worse? It's getting worse. And then when that doesn't work, because over time it's just going to get worse and worse, then you're looking at surgery. You're here right now because you don't want surgery. The problem with knee surgeries, 52% of knee surgeries require a revision surgery within the first year. And within 5 years, 76% require an additional surgery. Not to mention all the side effects with surgery, the cost with surgery, the scar tissue with surgery. And then eventually, when that's not working correctly, then you will then be sent over all the way to the left here to something called pain management for life. Now, this is when you're on high narcotic medications, opioids, very dangerous to the body. And like I say, you become a prisoner of this medication, because when does that end? It never ends. You're on these meds forever, and they're very, very harmful to the body. And so there are better ways, and I'm here to show you 4 main different options that are non-drug, non-surgical, minimally invasive, alternative technology that we have helped thousands of people to get back the life they love to live with vitality and living life on their terms again. When it comes to surgery, I'm going to show you this study. This was done by Berkeley Bedell, an Iowa congressman. He actually compared surgical knee replacement patients with stem cell patients. Now, when they did the study, they showed with the knee replacement stats, out of 223 patients, the average cost was $70,000. On average, 23 of those people would suffer surgical complications. 1 to 2 will die, 1 to 2 experienced pulmonary embolism, 1 to 2 suffered heart attack, and 11 to 14 will require readmission for serious infection and some insurance coverage, not all of it. So they were getting hit with big bills, even though insurance covered only some of it. So this is why we want to avoid surgery at all costs. So today I'm going to talk about 4 main treatment options that you'll learn in the office, and you will go over with our case manager. Our case manager, when we do the testing, they'll be able to decide and understand what of these 4 options you're a candidate for, right? And whatever ones you're a candidate for, they'll go over with you. And then together you could choose what will be the best option for you, a non-drug, non-surgical approach to getting well and getting back the life and activity you always wanted, which is freedom. Now, we're going to go over these 4 treatments, and I'll go more into it. Number 1 is called Genvisc 850, and I'll describe that in a moment, and OA bracing, or osteoarthritic bracing. That's very popular. Number 2 is actually extremely popular. It's PRP in combo with the Genvisc 850 and the OA bracing. Number 3 is nerve ablation, and number 4 is bone marrow stem cells from you, along with the umbilical cord matrix. And I'll get into them, and you'll understand every single one of them and what would be right for you if you're a candidate. The number 1 we'll go over is the Genvisc 850 with osteoarthritic bracing. Now, when it comes to Genvisc, and I'll talk about that in a moment, but let's start with the bracing first, because we must set the environment in order to do so. We use the top of the line offloading braces that do amazing for setting the stage for the Genvisc. Now, this is what the OA brace will do. It maintains range of motion during the healing process without creating abnormal stress on the joint as it heals. Remember those x-rays, how the knee would get sheared off, right? It actually helps that range of motion so you're not doing more damage. It will return the joint to its proper position during the healing process. So a lot of times when they're giving shots or other systems gave shots to people, they're not doing anything for the alignment of the joint, so it's not healing in the correct position, if healing at all. So this ensures the joint to heal correctly. Long-term use of the brace has shown decreased pain in patients and an increase in objective activities such as walking. Our goal for you is for you to be walking 1 mile per day. It also serves to open the degenerated compartment, where it's almost bone on bone, of the joint, making space for regeneration to occur and for the GenVisc 850 to be injected correctly. It actually will decrease excess inflammation for 6 weeks during the length of the treatment. Studies show that 6 months of bracing, using as needed, that means that you're using it when you're going to do activity, or you're going to only use it when you know you're going to do something that may cause pain. Just using the brace as needed cuts surgery by 50%. And in addition to knee bracing, the case manager may also suggest a lower back bracing as well, as when there's knee issues, there's always some type of compensation lean or allantogic lean of the lower back muscles, and that causes abnormal biomechanical issues in the lower back and knees. And it becomes a downward spiral again. So the knee is bugging you, so you start to lean the other way, then the back starts to hurt. And the back hurting causes you to shift over here, causing you to put more weight on the other knee. And then this whole thing starts to happen as the body decays. And so many times you will also get a low back bracing to help correct or keep that lower back exactly where it needs to be for total healing and optimal healing to happen in the quickest way possible. Now, what I love about this, just to show you, on the left, you'll see on where it says no brace, that is a knee with no brace. So you can see right where the circle is. See on the far left of that knee, you can see that the hyaline cartilage, you can see a lot of that space there. And then on the right to it, where it's circled, you see it's bone on bone, right? Nothing left. Now, just look, when we just put that offloading brace on you on the right, you'll see this is with the brace, took an x-ray. Look how it opened up that space. I mean, can you just feel the relief right there? It opened up that space. Now, is there cartilage? Did cartilage jump in there? No, but it opened up the compartment. It opened up the space to allow that cartilage to now regenerate and start to do its job, and where we could get the GenVisc 850 right in there. So this is why bracing, I want to give you a visual on how important it's going to be when you use it as needed. Now let's get into the GenVisc. So the bracing helps set the stage. Now we use GenVisc 850. Now you might be saying, well, I got shots in my knees before, and I totally understand. There's many other different companies out there. There's many different other things that could be injected to the knee and visco supplementation. But the reason why we use GenVisc 850, it is the only one proven to not only just add artificial synovial fluid in the knee, it actually, keyword, it actually stimulates your own hyaline cartilage to produce synovial fluid. So it doesn't just act as the synovial, it actually now stimulates your own body, your own cartilage to produce the synovial fluid. Again, the only one in there. Plus, there's different ways they use the protocol that will get you the results where other systems have failed in the past. So the GenVisc has been shown to reduce your pain by increasing joint function. It acts like a lubricant and shock absorber. It creates regulation of your pain. It actually binds to nerve cells and cools down the pain response. It maintains normal joint structure and stimulates that synovial release. It inhibits inflammation, and it helps block inflammatory cells. Now, the protocol, and this is the given technique that has gotten amazing results, is this. The GenVisc is a series of 5 injections per knee. 5 has been shown the one to give the best results. Other systems may do less, but we're looking to get you the ultimate results possible. 5 injections per knee. And again, remember, this is the only one proven to add only artificial synovial fluid in the knee, and as well as it stimulates your own hyaline cartilage to produce synovial fluid. It is also an ongoing therapy repeated every 6 months. Reason being is this is to replenish, to cushion, and stimulate healthy synovial fluid production from your own body without drugs or surgery. And when you think about it, like your car, right? You're bringing it, they top off all the fluids. You know, you maintain things in your house, like exercise. You know, here I work really hard to get my body to be a certain way, and then what do? I maintain it, right? I'm going to keep on doing those things now and then to actually maintain that result. And the whole reasoning behind this is our goal is to get you to an 80 to 100% medical improvement. and we want you to be able to keep it there. So that's why every 6 months, this becomes the routine for you. Every 6 months, no drugs, no surgery. This is to keep that body healing, to make sure we get you as close to 80 to 100% of medical improvement. And the exciting thing for a lot of people is what I just went over is covered by your insurance. So it's either no cost or very, very, very little cost. This is covered by insurance. Now, the next option, number 2, is PRP. What is PRP? It's platelet-rich plasma therapy. This is where we draw blood from you, your whole blood, we separate the platelets, and we put the platelets back into your knee. Now, it has a lot of growth factors in there. It's healing mechanisms of your body. It cleans out the joint and creates a regenerative response. This will actually create a better response when you combine it with the GenVisc and the OA bracing. So I highly, highly recommend that you combine the PRP with the GenVisc and the OA bracing. This right here is not covered by your insurance. It's starting at $900. It's $900 per knee. It's not covered by insurance, but if the GenVisc and the OA is covered by your insurance, this would be a great, great investment to combine together, but that choice is yours. But I highly, highly recommend that you combine the two. Now, the third option, the third type of treatment is called knee nerve ablation or a nerve block. This is where they actually go inside, they actually singe or burn the nerve. And it blocks the nerve, it shuts and numbs the nerve down, puts it to sleep for 12 to 18 months. The nerve will grow back. Here's the issue though, the nerve is numb, but is the problem still there? Yes, it is. And although it's non-drug and it's non-surgical, we don't highly recommend it compared to the other options that we're going over, 1, 2, and the next one, which is 4. So this is the one, even though it's non-drug, non-surgical, this is the one we really recommend the least. And now number 4, this is the big one right here. This is bone marrow stem cells, using your own stem cells from your bone marrow alongside using an umbilical cord Wharton's jelly, and I'll explain that. We choose your bone marrow because your body doesn't reject it. It's stem cells from your own body. It's a simple 10-minute procedure. We could get a lot of stem cells from your bone marrow, and there's no issues with matching because your body doesn't reject it. It's you. So let's explain what it is. Stem cells, or what they call mesenchymal stem cells, what do? These mesenchymal stem cells are the only ones proven to actually regenerate tissue. We are talking about the actual regeneration and healing of the tissue of your knee as it used to be. They are found in your bone marrow. They're MSCs, the mesenchymal stem cells. They're important for making and repairing skeletal tissue. They're potent anti-inflammatory cells. They moderate your immune system inflammation response, and they stimulate and regenerate repair. Now, the way we harvest it is, you could say we do a needle biopsy right in your iliac crest in your hip. We get right in there, we go right in there, we pull out that bone marrow, we're able to pull out enough of that bone marrow and the stem cells, and then we proceed to inject it into the compartment of the knee that's degenerated. Now, on top of that, or alongside, we'll also use a regenerative medicine allograft or umbilical cord tissue. We call it Wharton's jelly. Many systems, they might just do the bone marrow, they might just do the Wharton's jelly, but if you're a candidate and you qualify, we actually do both. We'll do the bone marrow because it's your stem cells, and then we bring in very young, very powerful growth factors from day 0 cells. This umbilical cord tissue matrix, it comes from healthy and human afterbirth. It's not baby, it's not mom, it's just the umbilical cord tissue in between. It's full of cytokines that cool down inflammation, hyaluronic acid that lubricate, scaffolding that helps your bone marrow stem cells work, and growth factors to help the bone marrow do its job, the stem cells from your bone marrow. It's FDA cleared lab. There's 0 reactions whatsoever. There's no rejection whatsoever. So when we bring the two together, our 1-2 punch using the stem cells, the bone marrow, and then alongside that we bring in the umbilical cord tissue, the Wharton's jelly, this is what it creates. The younger the cell, the more powerful the cell. Remember, we're not lubricating here. The cartilage is going to regenerate. It's actually going to grow back. These cells will not be rejected from your body. and you're getting the mesenchymal stem cells from the bone marrow, and you're getting the potent, young, strong growth factors from the allografts. And number 4, what a lot of people like, it's a one and done procedure. You do this procedure one time. The regeneration that occurs you should be able to last, by the time you would ever degenerate it again. It's one and done procedure. This procedure of the stem cells, it is not, I repeat, not covered by insurance, and it starts at $6,800. That's where it starts. So to go in the review, the 4 treatment options that you go over with your case manager to find which ones you're a candidate for and you qualify for, the GenVisc 50 and the OA bracing. That one is covered by your insurance. Number 2, it's the GenVisc 50, the OA bracing, along with PRP. The PRP is not covered, but again, I think it's a great investment on top of it. It really gives it a good kickstart. Number 3, the nerve ablation. Again, we do not recommend that one. It just kind of deadens the nerve for up to a year. And number 4, it's the granddaddy of regeneration. It's the bone marrow stem cells from your bone marrow, along with the umbilical cord matrix. And again, you will discuss with the exams with your case manager which one will be the best fit for you, or a combination of those as well. So now imagine your life pain-free. Remember in the beginning, what was that one thing you wish you could get back? Imagine getting that back. Imagine being able to walk up and down stairs, play with your grandkids, go dancing, do that gardening, ride your bike, go traveling. Imagine getting all that back, getting autonomy, getting freedom back in your life, without drugs, without surgery, and without pain management for life. Our goal is this for you. It's for you to avoid dangerous drugs that just mask the problem. Surgeries that what? They just lead to further surgeries, and they actually then lead to a lifetime pain management quickly down the road. And the way we're going to do this is we do it by using a non-drug, non-surgical, proven technologies to get you out of pain, to increase your vitality, your quality, and your freedom of life, allowing you to live life on your terms once again. Well, thank you so much for being here. Hope you learned a lot. Any questions, let your case manager know. Also, if you have friends and family that are dealing with knee issues and back pains, they might not know this technology is out there. Please let us know, and we can reach out to them, and you could help them as well. Well, we look forward to helping you live life on your terms once again. Have an amazing day, and I'll see you soon.